This program contains subject matter and language that may be disturbing to some viewers. Viewer discretion is advised.
The term inhalant does not refer to a specific compound, but to a method of substance use that introduces any wide variety of compounds into the user's body. This intentional inhalation of a volatile substance for the purpose of achieving an altered mental state. Inhalation of a toxic agent is also known as huffing, sniffing, bagging, and spraying.
She was studying to be pre-med, but now my sister is a drug addict.
Historians believe that the use of inhaled compounds to alter the user's perception of reality may be traced back to ancient Greece. People would inhale fumes from a volcanic vent and then, while in a state of delirium, deliver prophetic statements. Cool, huh? In the 19th and 20th centuries, various solvents became available more easily, and these compounds were quickly abused by inhalation. Until the 1950s and 60s, mainstream media paid little attention until the practice of sniffing glue became popular. Liquid glue often contained the compound toluene, which, when inhaled, can alter the individual's consciousness. Toluene has since been removed from glue.
The inhalant that Allison uses is a duster cleaner for computers.
The chemical content is called toluene. Avoid skin contact with freezing liquid. Avoid inhalation. Keep out of reach of children.
In many third world countries, inhalant abuse helps to dull the individual's awareness of hunger. It is especially popular in Europe and Japan for recreational purposes.
Inhalants are not a drug. Inhalants are a range of compounds with the same method of abuse.
A true inhalant is absorbed through the lungs and then passed into the general circulation from there. Common inhalants used are various cleaning agents, herbicides, pesticides, gasoline, kerosene, certain glues, paint thinner, and some chemicals used in felt tip markers.
There are approximately 1,400 available products to be inhaled worldwide. These products fall under 4 categories called the Espelans classification system: volatile solvents, aerosols, nitrates, and anesthetic gas. Volatile solvents including paint, nail polish remover, and lighter fluid. Aerosols including hairspray, spray paint, and room fragrances. And nitrates including butyl nitrates, amyl nitrate, packaged in ampules or capsules, used for treatment of angina, often broken open and inhaled.
General anesthetic gases, called laughing gas by dentists, is often sold at rave concert, and it is the hardest to obtain.
According to Anderson and Looms, the peak age of inhalant abuse is 16 to 17 years, with onset in children as young as 11 or 12 years of age.
There are reports of children as young as 3 years old abusing inhalants. Therefore, it is important to keep in mind the fact that children do abuse inhalants on occasion.
It is thought that over 2 million people in Canada have abused an inhalant in the past year. For children, inhalant use is mainly experimental, and use is limited without the children going on to develop any drug problems. If children were to engage in prolonged periods of inhalant abuse, the number of abusers in the past year would be much higher.
One of the main causes of inhalant abuse is the fact that it is readily available in workplaces and in homes. Inhalants are legal, inexpensive, and easy to obtain.
Abuse potential: quality and pattern of high, rapid onset of effect, low cost, availability, and legality. Generally, inhalant abusers will abuse any available substance. Somebody who starts off sniffing paint thinner will abuse dust-off or other household cleaners, depending on what's available to them.
Inhalation intoxication resembles alcohol intoxication, stimulation, and loss of inhibition, followed by depression, disorientation of perception by time and space, similar to anesthetics, which slow down body functioning. Use of solvents can cause serious but reversible damage to the heart, kidney, liver, bone marrow, CNS, and the brain. Brain damage is typically seen in chronic long-term use and not in short-term exposure. Respiratory issues such as bronchitis and pneumonia are identified. Problems such as hematuria and proteinuria may indicate renal failure. The inhalation of gas may cause neuropathy, Anemia, leukopenia, and electrolyte imbalance may be found in lab tests. There may be signs of gait impairment and poor coordination, as well as signs of tremors. Some solvents can cause hearing loss and limb spasms.
A huff or rash may develop around the mouth or nose of the inhaler after use of a product. Other outward effects of the body include dry skin after contact with a substance that may lead to small cracks that allow bacteria into them. Repellents such as those found in computer cleaners may cause frostbite to the nose or mouth and may compromise the airway.
This is how inhalants are used. Using inhalants. We're going to use some inhalants. Let's all use some inhalants. Inhalant use.
There are 4 different ways inhalants are used. They are spraying,
Huffing.
Sniffing.
Bagging.
Death from inhalant abuse can occur in several different ways. Sudden death. High doses may lead to CNS depression, which can lead to respiratory arrest of lower airway protection reflexes and result in aspiration and a blocked airway. Suicide. The frequent method of inhalation is bagging, in which the inhaler passes out with the bag still wrapped around their head or body, which can cause suffocation. Injury. Often users have a feeling of invincibility, which makes it common for them to try crazy things they wouldn't normally do, such as jumping off a building.
The next is suffocation. You can cause asphyxiation by decreasing the oxygen levels in your body. And you can also cause hypoxia by bagging, basically, because all that's in the bag is your own CO2 from breathing and the solvent that you're choosing to get high on. So your body's main reflex for breathing is just to breathe out CO2, and that's what you're doing. But by the time your body realizes that it's not getting any oxygen or room air in, it's too late and you're dead. You're dead. You're dead. Go.
Whoa, what are these marks all over my face?
Those are burns. Inhalants are flammable, which can cause burns, especially in cases where you're smoking while inhaling. You gotta stop that, Jordan.
I really do.
Substance abusers can be categorized into 3 different types of users: experimenters, intermittent users, and chronic users.
The main leading cause of death in inhalant abusers is sudden sniffing death syndrome.
When sudden sniffing death syndrome occurs, hydrocarbons and other inhalants sensitize the myocardium to epinephrine, and when this hormone is produced in response to any of a number of stimuli, most commonly sudden stress or fright, a fatal cardiac arrhythmia can result. Sudden sniffing death syndrome leaves no evidence that can be identified in an autopsy, which makes it a relatively invisible problem.
22% of first-time users died from sudden sniffing death syndrome.
With short-term use, the most common cause of death is aspiration while the user is unconscious, or a combination of respiratory depression and hypoxia.
Although overdose may occur, other factors are more common to cause death. In the 1970s, sniffing glue became popular among the youth punk subculture. It was a cheap high and it fit their image and it shocked the adult society. That's why in the 1970s and 80s a lot of songs were written about sniffing glue or inhalants.
Often, one of the most common reasons for experimentation is peer use, as well as the idea that no harm can come from such use.
Wrong!
Other factors that influence inhalant use are
Poor living condition.
Trouble with the law.
depressive or suicidal behaviors,
troubles with family,
history of abuse, violence, or abuse of other substances.
Solvents and gases are ingredients in hundreds of available and inexpensive products,
such as deodorant sprays, hairspray, and air fresheners.
Inhalants can be found in households as well as drugstores. Often you don't even have to purchase the product to use it. Many people just go in and sniff whatever they'd like and walk out. Canada has few laws that prohibit the inhaling of substances in public places.
That woman rings me up every single day, but the problem is it's not illegal, and I'm over 18.
Did you know butane, which is found in lighters, is the most commonly abused solvent in the UK and accounted for 52% of solvent-related deaths in 2000?
Benzene, which is found in glues, paints, and furniture wax, can cause bone marrow depression.
Toluene, found in rubber, adhesives, and disinfectants, can cause damage to the myelin.
A long-term effect of inhalant use is toxicity. This can cause cell death by apoptosis.
Female inhalant users who are pregnant have adverse effects on the fetus, such as low birth weight and birth defects similar to those babies born with FAS.
There is a very low number of statistics on deaths related to inhalant abuse. This is mostly because they're underreported, because most deaths are categorized as strokes or heart attacks, even if they are because of inhalant abuse.
That's the end.